rates are 2 times what our threshold is to be on the monitoring list, they're not eligible for a waiver. But again, if the local trends look good to the local health officer, they'll also be taking into account what are the local community resources? What is the hospital capacity looking like? What are the testing resources locally? What are the local resources around case and investigation and contact tracing? All of those and other considerations in partnership, again, with the school district and the community, the local health officer may consider granting that waiver, again, for our youngest children. And then they do need to consult with us as the California Department of Public Health, and we will provide consultation, and then the local health officer can decide whether or not this seems like a safe option for the community for those children in that elementary school or school district. So that is sort of the process as outlined. We will have posted all those documents yesterday, and with that, I will turn it back to Secretary Galley for other questions. Thank you.
Thank you, Dr. Pond. And I want to go and quickly walk through a series of slides that updates you a bit on our overall strategy in California. So I want to first remind you that our story has not yet been fully written. Although we are proud of our collective work so far, we are in this for the long run. We have a long way to go. I often like to say we're in the top of the third, bottom of the second inning of a baseball game, and we still have a lot longer to go. And with that, we are increasingly confident that our approach, which has been data-driven with a commitment to ongoing learning and adapting and adjusting, will help guide us through California through this pandemic over the many weeks and months to come as we experience this initial phase, this initial first wave, and into second waves and even third waves down the road. That our preparedness, that our learning, that our ongoing work on our messaging is going to help us throughout this entire response. I want to just take a moment to talk about one of our chief goals, which is to corner the virus so we mitigate spread. We often talk about mitigation. We often say we want to stop the spread. And this simple diagram really puts it at what I'm going to try to do is a more personal level. So let's imagine that I had symptoms, which I do not, thankfully. But if I had symptoms, we would go to step one, and the first thing I would do is quarantine. I would decide to be at home following public health guidance to be there for 14 days and make sure that if I share the house with any family members that I'm careful to keep some distance, that we disinfect and wash surfaces, that we really do try to keep a little more separate than we normally do. So if there's a risk that I am infected and my family member isn't, that they don't in fact get infected as well. Then the second thing is we work to get me tested, and we try to get that to be timely. That means that the specimen is collected in a timely way, that we get it to a lab that processes it, and that we get that information as quickly as possible so it's actionable. And then with that test result, let's say it is positive, then I go from what we talk about as quarantining to isolating. Very similar, remain at home for that 14 days, watch closely for the development of symptoms, and make sure that I'm careful not to interact with anybody who's either known to be positive or has not been a close contact as of yet. And then I work with the public health officials in my community to begin identifying my close contacts. Obviously, people who are living in my household, but then also for me, people that I work with, that I may be seeing on a regular basis in an indoor setting. Even though I'm good at wearing my face covering when indoors and not alone, it's still very important that we identify those close contacts so they can also quarantine. And then with public health guidance and following our recently released testing priority list, that they may also need to be tested. And so the cycle goes so that we can identify those cases and make sure that we cut down those roads of transmission so that we reduce the number of cases ultimately in California, the number of people who become very sick from COVID, need care in the hospital, and God forbid, but that we prevent as many